Yeah, I'm Renzo from the Philippines. It's good to be back, 5 years ago, Germany is the first country that I visited outside of the Philippines ever. And I was blessed to be part of an environmental studies, a week-long environmental studies course here in Cologne. And I feel blessed because one, I'm from a developing country, and it's so hard to find cheap flights going to Europe. And secondly, I'm a medical student. What am I doing in environmental studies, And that just shows, and I think that was the moment when I got launched to the world of global health and the globe at large, global understanding. And I'm very happy that I'm back. And right now, I'm going to talk about, just give some student perspectives on what should be the form of global health education for the 21st century. Okay? And I had my share of global health workshops and courses. The first picture is actually the annual Global Health Course workshop in the Philippines, in the University of the Philippines, which is held during every summer. And it's interesting because it started in early 2000s. It was started in early 2000s by students. There was a student who went to Finland and another student who attended a global health conference. They went back to the medical school. They asked the faculty, we need a global health workshop in our university and in our country. And since then, I was one of the early alumni, and I've been working closely with the faculty in organizing this global health workshop for Filipino medical students and pharmacy students and health students in general. The second picture, you will find a familiar face, so that's Max de Corten. And last year, I was also blessed to be part of the Copenhagen Summer School on Global Health Challenges. And then the last picture is the International People's Health University that is organized by the People's Health Movement. And this particular course, which I took in Cape Town last June, gave me a different view, an alternative view of global health, and gave me some kind of an activist hat. We've been talking about global health education for the past hour. We've listened to a lot of good examples from across Europe. But these are some of my key and basic questions. First is, who teaches global health? Are our teachers the ones who just read their global health from global health books and a pile of Lancet articles? Or are these real practitioners? Are they in the front lines, whether in the community or in the halls of global health politics? My second question is, not just who teaches global health, whose global health analysis are we teaching? Is it the global health of the World Bank, the global health of WHO, the global health of the People's Health Movement, or the global health of a doctor inside a clinic? Next question is, how do we teach global health? And we know that there are so many methodologies that different institutions have tried and are trying at the moment. It can be in a lecture form, it can be in a form of a small group discussion, it can be held outside, and that leads me to the fourth question. What are the conditions in which we teach global health? And I find the hospital and the medical school too artificial, too aseptic, for medical doctors for the 21st century to be able to face the current global health realities. My next question is, what kind of doctors do we want our students to become? Do we want them to be global health leaders, to become change agents, or just mere professionals in a hospital or in a healthcare system? And lastly, when to start teaching global health? And this is an interesting fact in my university, that in the University of the Philippines, on the first week, we don't open our cellular biology or Bern-Levy physiology or Harrison's internal medicine. We read the Alma Ata Declaration, and we discuss every provision of the Alma Ata Declaration. So that from the very beginning, the medical student wears the Alma Ata hat, knows that health is a fundamental human right, that inequities in health are unacceptable politically, socially, and economically, and that we should do something about these inequalities as a global community. That's the message of the Alma Ata Declaration of 1978. Next, a lot of the speakers have already touched about what should be the content of global health education. I just simplified it. We need to know the epidemiologic basis of global health, burden of disease, environmental basis, climate change, sustainable development, air pollution, and others, social and cultural basis. So it's not just the social determinants of health, but cultural determinants of health, and we need more culturally competent doctors as we see a lot of people moving in this world. Political and economic basis, the political economy of health, trade arrangements, global economic governance, and how they impact health directly or indirectly. And the moral ethical basis, human rights, the core value of justice. And we also need not just information, you know, we want to get rid of information. We had lots of that in medical school already. We need the tools to make the difference. And this leads me to the values of global health education. It should be values-driven, focus on justice and equity, on human rights. We want an action-oriented global health education. We want that at the end of the global health course, we go out of the room and we know what to do, and we have the tools in order to face these global health challenges. We need to adopt a systems way of thinking, especially now that it's a global health system, it's an ever complex system that we are in, and we have to be able to navigate the system, know the actors, know how to deal with these actors, and know what changes we want in the system. And then futures thinking. We want to be goal-oriented, we want to have targets, we want to know where we are going to head to. And this is the scary part, or the hard part, because I'm giving reminders. I'm a young person giving some reminders to younger people in front of me. Okay, so first is global health education is not just about overseas electives. This is a misconception. It is also about understanding and acting on community issues backed with global knowledge and tools. Okay? Second, one model cannot be easily transplanted to another setting. Context really matters. I've seen a lot of fantastic global health education models, but you cannot easily transplant that to Asia. We need to look at our health issues from an Asian context, through an Asian lens, and the same way with Africa and other developing parts of the world. We don't need additional information. We need a global health education that liberates students from conventional medicine and raises the level of critical thinking. In med school, we are already taught how to be critical thinkers. We need more critical thinking. We need to develop more critical thinking to begin to question, why is my patient getting sick all the time? Okay? Next, global health education should contribute to the achievement of expressed global health goals, not just a floating appreciation of the theory and the current situation. This is my fear, because sometimes we measure our global health education, the success of global health education in the number of participants in a workshop, but we are not able to monitor how many of these students actually went to the communities or to the halls of WHO to point out the problems and to find their theoretical solutions, quoting the great Rudolf Virchow. All other professions, including lawyers, economists, political scientists, engineers, should receive basic global health education. We've been talking about social determinants of health. We recognize that most of the factors that affect health are outside the realm of health, but we are not talking how to educate them to actually work with us and to understand the issues within our sector. So again, interdisciplinary, we need to reach out to other faculties. Holistic global health education requires learning from other disciplines. Interprofessional learning is key. More reminders, global health education should never contribute to global health inequities, especially in health workforce distribution. That's another one of my other fears, that because medical students from the developing world will attend all these global health courses in the developed world, and then they get enticed to stay, and then they are not able to bring back the knowledge to their home countries. Next, access to global health education should also be equitable. There is a need to promote the vision to the Global South, and I hope that in the World Health Summit in Singapore, we will be able to conduct some global health education sessions also to bring these virus to the Asia-Pacific region. Because the irony is, medical students in countries where our students often go for global health learning electives, they do not get to enjoy the same experience. Okay? And lastly, I think the most crucial question, do we really want global health to be merely incorporated into the existing medical curriculum? Or should we transform medical education as a whole in order to meet global health needs? And I think that's the message of this fantastic report, 2010 Lancet Commission on Health Professionals for a New Century. And there's some fantastic examples. In the Philippines, there's one school called the School of Health Sciences in an island of Leyte. And their medical students, they come from impoverished communities, actively recruited from their provinces. They don't pay anything, but the requirement is they have to go back to their communities. They don't study basic medicine in their first year. What they do is understand the community, understand the health system, and learn communication skills and management skills. And so the result is 99% of their alumni for the past 30 years have stayed in the Philippines. And this is saddening because we always see different movements, as separate in global health. We have the universal healthcare stream, the sustainable development stream, the social determinants of health stream, and then the medical education reform stream. But they are all interconnected, and the medical education and global health education movement should catch up with all these rapid developments in the other streams. So we hope to see more communication and coordination so that we address education, we address health, we address environment, we basically improve our world at large. And then, this is saddening because oftentimes people will tell me, oh, the medical students are not aware of global health. Or medical students don't want to learn global health. But should we blame them for not knowing or not wanting global health? Shouldn't we be creating the conditions for them to know about it and to want it, and also to repackage global health? It's not something that we want, but something that we need to understand and act on as future physicians. And as I said there, they are not apathetic about global health. They talk about it all the time. Maybe not using the term global health, but they are aware of global issues like elections in the US and many others, but they're just afraid to look pathetic because they don't have the tools and they don't have that enabling environment to nurture their global health knowledge. Global health education development must be a two-way process. Students must be deeply engaged in shaping the curriculum. And we've seen some examples. And if existing curriculum does not allow it, students innovate and find ways. IFMSA was created to offer future physicians an introduction to global health 60 years ago. So 60 years ago, there's already a dissatisfaction among medical students about the traditional medical education. And then we had workshops in the Philippines, and we brought them to the halls of power in the Western Pacific Regional Office of WHO, to the places of the powerless, the communities, and they learned about the challenges that health workers face. We had a session on universal healthcare in India. 40 medical students from all continents gathered to discuss universal healthcare and how we can be part of this movement. And then in Asia, we had 300 medical students talking about global health last September. In fact, look at our t-shirt. This is our subtle way of spreading global health education. I'm a global health doctor, the world is my clinic. And this leads us to question the role of the physician in the 21st century. Should a physician be more than just the physician that we are trained to become and that we find on TV and etc.? And lastly, there's no better place than Berlin to invoke the spirit of Rudolf Virchow, the father of social medicine. He said that medical education does not exist to provide students with a way of making a living, but to ensure the health of the community. I'm thinking, with that definition of medical education, global health is already intrinsic in medical education. We just forgot to make it surface and to manifest. So I hope that we will continue to nurture and nourish a global health education that will enable us to reach health for all in our generation. Thank you.
How does one keep time control of a bunch of people who are used to be passionate about their topic and are difficult to stop talking. But I hope all of you got inspired. I hope all of you have tons of questions to ask. So just show me some hands if you do have some in fact. Yes. If you stand up and shout. Maybe you can say who you are.
I'm Joshua.